Hi, this is Michaela Warner. I'll be performing my N142 assessment. I have my patient sitting on the bed over here. I have my person filming behind the camera there. We'll do a quick sweep of my room. Please note there are no rubrics or extraneous papers anywhere. I do have my laptop on the bed. I'm going to be reading my scenario from that sheet. I'm going to go ahead and read my scenario. I got scenario E. Madeline Thompson is a 70-year-old female who presents with complaints of blurred vision and left-sided facial paralysis. She is able to walk, but the nurse notes she is unsteady. Mrs. Thompson's speech is slurred and she is crying. Her husband tells the nurse that his wife is active and volunteers at a local long-term care facility. Vitals, temperature is 99, pulse rate of 100, respirations are 24, BP is 160/94. I'm going to go ahead and note my abnormalities here. Right off the bat, I would note the blurred vision and left-sided facial paralysis as an abnormality. Her gait is quite unsteady, so I'll be assessing for that as well. She has a slurred speech, so I would be noting that as well. And I'd also be noting those vital signs. They are elevated, so I will be keeping those in mind as well. Hi, my name is Michaela. I'm going to be your student nurse today. How are you?
I'm good. How are you?
Good. Can you tell me your name and date of birth?
Madeline Thompson, August 4th, 1950.
All right, Maddie. Let's go ahead and check your wristband here. My hands are a little cold. Okay, that looks good. I'm going to go ahead and pull the curtain. So I read that you are coming in. You have some blurred vision and you're walking a little bit unsteady. You have some paralysis in your face. So we're going to be doing some tests to assess those things.
Okay.
Okay. I have a few questions for you to start. Can you tell me when these things started happening?
A few months ago, 3 months ago.
2 months ago, okay. And where are they?
It's all on the left side of my body. Left blurred vision is in my left eye, paralysis on the left side of my face, and unsteady, feeling like I can't stand up straight on this side, tipping that side.
Okay. And when this happens, how long does it last for?
A few minutes for each episode. No problem.
Okay. Can you describe it to me?
It comes up suddenly. I could be doing anything, and all of a sudden it just started to feel numbness in this side of my face. The blurred vision follows that. I feel like I can't open my eye quite, but it is open. It's just that the vision is so poor on this side, and then sometimes if I'm standing, I'll have to sit down because I feel unsteady.
Tell me what makes it worse.
Looking at screens, television, computers, anything like that.
Okay. Tell me what makes it better.
I usually lay down for a couple minutes, try to close my eyes, and wait it out that way.
Got it. Okay. You try anything over the counter? Any meds at the store that you thought to try?
Not really. I don't take Tylenol or anything because there's really no pain. It's just uncomfortable.
Okay. Now, your pain right now, I want you to scale it for me. 0 is there's no pain at all. 10 is the worst you've ever felt. What would you say it's at right now?
Right this second, I'm not at all, so 0. But when the episodes happen, it's more like a 2 or a 3.
Okay. Well, thanks for answering my questions. I'm going to go ahead and get started with. I need you to stand. I'm wanting to assess that unsteadiness when you walk first. Okay. The first test is called our tandem walking test. This assesses balance. So now what I need you to do is walk from here to that chair, heel to toe, like that. Okay? All right, go ahead, and then you can walk normally back. Good. Okay, come back. Our next test will be our Romberg test. So what I need you to do, stand very straight, very good. Hands at your sides, close your eyes. And what I'm assessing for here is balance. And I was assessing that with our tandem test as well. I'm just making sure that there's little to no swaying happening when her eyes are closed and she's standing straight. There is a little bit. Okay, go ahead and open your eyes. You can have a seat. You okay? Okay. We're going to move on to our next test. Now the next test, just again, I'm just looking at your motor skills, okay? Our first test goes like this. Put your hands this way. I'm just going to have you touch your finger to your thumb this way and then go backwards. And I want you to do that as fast as you can while closing your eyes. Okay, ready? Go ahead. Okay, you can stop. Very good. Okay. Our next test goes like that. Also to note, she was able to do that fairly fast, so I would note that looked good. Our next test, we call it supination and pronation. You don't need to worry about that. All I need you to do is put your hands on your thighs there, you're going to flip them this way as fast as you can. Again, your eyes are going to be closed. Okay, you ready? Go ahead. Okay, and stop. All right, she was able to do it there. They did kind of lift off of her thighs the more that she did it. So I would write that in my assessment, okay? All right, our next test goes like this, arms out at your sides. You're going to take your pointer finger and touch your nose like this, but your eyes are going to be closed. I want you to do that as fast as you can. Are you ready? Go ahead. Good, and stop. Okay, Madeline was able to do that fairly quickly. I would note that well, that test was good. All right. Now, our last test with the fingering things goes like this. I'm gonna have you touch your finger to your nose and then touch it to my finger. My finger is gonna move, okay? And then this one you can do with your eyes open, okay?
That's good.
All right, and go. Good, 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 whoop, good, and stop. All right, you did that pretty well. There was a little bit of a mix up there at the end, but you pulled through. So that went very good. Yes. Good. So Madeline, there's one more test this way that we need to do. I'm gonna have you hold your arms out this way. What I'm gonna do is move your finger up or down. Your eyes will be closed. All you have to do is tell me if that finger, you feel it go up or down by saying up or down. Okay, can you move your feet out a little bit this way? Very good. I'm gonna note the same thing. So I'm gonna do the same thing with your toes. Okay. And I just need you to say up or down when I do that, okay? All right, close your eyes.
Up, down, up, down.
Good, okay. You put your arms down. I'm gonna do the same thing on your feet. Keep those eyes closed.
Up, down, up, down.
Okay, very good, okay. Now we're going to assess for pain. I'm gonna go ahead and grab these things here. I have my tongue depressor. I had to break it in half. So what I have for you is a tongue depressor and a cotton ball. Now what I'll need you to note is whether or not what you feel is sharp, dull, or soft. Okay, I'm gonna do that on you, okay, on your face. It could be on your hands or your legs as well, okay? Keep your eyes closed.
Dull, sharp, dull, soft, sharp, dull.
Okay. All right, Madeline, you did very well with that assessment. That is all I have for you. Thank you very much. I'm gonna go ahead and perform hand hygiene one more time. And I'm gonna go pass this on to the doctor, okay? See what they would like to do for you further. Thanks for bearing with me, Madeline.
Thank you.
All right, enjoy the rest of your day. I'll see you a little bit later.
Thanks.
I'm gonna open the curtain. And I'm out. And I'm gonna do one more scan of the room. Just to note that there are no papers or any extraneous things around in the room. Okay, this concludes my assessment. Thank you.